Welcome back to the morning show here on the Rise News. My name is Christian Obido. Well, sorry about that. That Charles inadvertently signed the show off. We still got a guest here in the studio and would be talking to Oji Okpi on what is trending. But for now, let's talk with Dr. Emeka Okor, who is a medical practitioner. We're looking at the future of the Nigerian health sector. You saw the screaming headline today in one of the papers where 40 medical staff at the Lagos University Teaching Hospital, the University of Ilorin Teaching Hospital, are in isolation. What kind of dangers do the health workers generally face in pandemics like this?
So, Christian, thank you very much for having me in Edit, and a very good morning to Nigerians and everybody around the world. Definitely, COVID-19, the issues with where you actually have patients coming into hospital, okay, and hiding issues and the history about their travel and all that. Lots of people are scared. In terms of the isolation of people, and so definitely everything that needs to be done during this critical period where we have these problems should be done. It is sad that you actually have issues where people are not actually coming forth and actually saying the truth and giving real history of around their illnesses in this particular time. And I want to use this as an opportunity to tell everybody that if you do have symptoms, you're going into a hospital, the healthcare professionals are asking you key questions surrounding your symptoms and all that. Please give these healthcare providers the appropriate information. The issues in Lut and in Ilori, they are doing the right thing. Of course, when it comes to capacity within our healthcare space in Nigeria, we are struggling. We can only do what we have the capacity to do, and I really wish them well.
Yeah, wishing them well. Is it that there is a shortage of the personal protective equipment, the PPE, in the country to medical health workers? What's the situation?
Well, basically, the situation is that for a very long time, Christian, in Nigeria, we have struggled within our healthcare system. Okay, now all of a sudden, there's COVID-19. Of course, you're not going to manufacture PPEs from nowhere. You're not going to all of a sudden have proper leadership and management within the healthcare space. Okay, so we will struggle. PPEs. Do healthcare professionals on the front line, do they have enough PPEs? Christian, we know what the answer to that is. We know that. Okay, I guess the question will be, how do we actually move forward from this dire situation that we are? Because like I said, Christian, we've struggled with healthcare at all levels and all facets of healthcare in Nigeria for more than 45 years. Okay, so now that we're hit with something like this, a pandemic, okay, of course, we are going to struggle. But of course, even if we are struggling, we must find a way within that struggle. Okay, we're talking about the CA COVID group from the CBN, and we're looking at 15 billion naira. Different people are donating money and stuff. Of course, the question will be, we've struggled with our healthcare system for a very, very long time. How come it's now that big men are actually, and different organizations are donating money for healthcare? Oh, there's the pandemic, everybody's scared. Okay, good, all well and good, no problem. We are in a big city.
I thought it's a great opportunity to rejig or rejuvenate and re-engineer the healthcare system.
Absolutely, Christian. But I'm just saying, do you understand? I'm just saying that, man, in a way, maybe there's a silver lining with this pandemic and all the problems that we are having now. Okay? And of course, there are lots of questions being asked, Christian, about this money that's been pulled together by this group and the reality on the ground, in the field there. Is this money, you know, in terms of deploying resources down to the front line, is this money actually getting to the people? I'll tell you, somebody told me yesterday that, one of my colleagues in the UK, that one of the teaching hospitals in the southwest area, that the big teaching hospital, very well known, I won't call the name, that they on social media they are saying, oh please, our previous staff or previous people, can you donate money for this and that and stuff like that? And you're like, wow, why? We are hearing on this on the news and on the air that there's this group that they are donating lots of money and stuff like that. How come that money is not translating in real time to the people on ground, getting the PPEs, building their capacity to actually deal with this thing? And I was watching when you were having discussions with one of your colleagues just now, and we talked about the issues, and you were talking about the issues of the frontline staff and how they're being looked after, and how you're actually creating a platform for them, you know, to actually become comfortable and confident to actually provide the care that people need, and that the sick people will need at this particular point in time. So it is a bad situation, but we have to find a way to actually move forward from here.
Well, there are interventions here and here. I mean, apart from the federal government stimulus package that it's putting together with several trillions of naira. You've talked about the private sector too, in collaboration, for example, with the CBN, who they've pulled more than 25, 26 billion naira. It takes time to distribute these. Technical committees would have to be set up on how to manage such huge monies. Don't you think so?
Very true. But let me tell you what the problem is, Christian. You understand? For a very, very long time, the capacity to deal with emergencies, the capacity to deal with things like this has not been there. Okay? So it's not surprising that when you run into trouble like this, in terms of this, the efficiency and the effectiveness of the kind of things you're talking about to deploy these resources and stuff like that, we will struggle. There's no doubt about it. Okay? That's why this is the silver lining. That's why we must use this as an opportunity moving into the future. Okay? Absolutely important. Okay? Absolutely important. We must find a way to use these resources appropriately. Because the truth is that this thing in Nigeria of thinking that every problem that we encounter, you throw money at it, it does not work like that. Okay? We have to have strategic leadership and management in place, and we are struggling with that question. Let us not joke.
The health sector is usually led by medical doctors, qualified health professionals, and the rest. So why aren't we making headways?
So good. So usually I classify the human beings in Nigeria, for example, into three. We have the political elite, we have the middle-level leadership, and then we have the poor people who make more, almost like 65 to 70% of Nigerians. Okay. The key thing, Christian, is that the political elite will not on their own have a light bulb moment one day and say, oh, we now want to be good, we now want to look after Nigerians and stuff. It will not happen. So who now has the responsibility to put them on their toes and put pressure on them? It is the middle level leadership. And who are those people?
Is there a middle class in Nigeria?
Well, those are the doctors you're talking about. The chief medical directors, okay, the people who are running the hospital management boards and stuff like that. The problem with middle level leadership is that they've refused to come together. You find that the nurses are fighting doctors and stuff like that. And
they're always going on walk to rule.
They love it.
But they're always going on walk to rule, like the National Association of Resident Doctors and even the NMA.
Because it is very simple. You understand? You have a political elite that is in largesse and enjoying, and everybody in middle looks over and says, oh, I love to be like those guys, man. I love to be like those guys. You know, because I'm not getting what those guys want. No, I'm going to try and see if I can get there. And that's why you find out that most people in middle level leadership do not want to tell truth to power. For example, anytime I speak on the media like this, I tell people that, see, no matter who you are, be the president, the senate president, and stuff like that, if you do not have critical care facilities in your country, okay, if you have a critical care condition, you cannot fly anywhere. You are like the rest of the people. The poor, there's no difference at all. Okay? So the truth is that the issue, I always talk about the tripod. The tripod of foundation of any civilized and thriving society. And what is that tripod? Healthcare, education, and infrastructure. You cannot run away from it. Okay? For a very long time, that's what I will beg Arise TV and other media houses. You understand? After COVID-19, this issue of actually putting healthcare by the side and as an afterthought. Can we please change that narrative? Let's use COVID-19 as a silver lining, because we have to start putting pressure where pressure needs to be put. As an individual, a group, a community, a country, or a state, nobody gets better and improves without pressure. The middle level leadership, the doctors like we talked about, they have to start doing their job. They have to start telling truth to leadership. Healthcare is not about building hospitals. Please, it's not about building hospitals. You can build structures and commission them, and you are wasting your time. Healthcare is about leadership and management, understanding what we call the value for human life, and making the value for human life a mainstream socio-political issue, which dovetails into everything. And then you see when you have electioneering and things like in UK and US, what is the first thing you talk about? It's healthcare, Obamacare, the National Health Service. That is the mainstream thing, because those people, they look at governance like, oh, we want to put the best for our people. When will we get there in Nigeria? Like I said before, Christian, you cannot leave that to the political elite alone and say, oh, do whatever. I've had discussions with my colleagues recently, and I'm saying, hey, this is an opportunity. We need to now rise up together, pull together, and say, hey, look at the issues. We must face the issues. Okay? And most of them are like, this government, this political elite, no. By the time this finishes, just watch it. It's going to be business as usual. But and I said, no, we cannot just say that, because we know the leadership, after this, let's just relax. No, it is time to put pressure where we need to put pressure. Look at the statistics, Christian. Look at the statistics. UK, with a population of 66 million, has almost 300,000 doctors in their employ. Nigeria, with a population of 200 million, has less than 40,000. What are you talking about?
So Nigerian doctors are, they've emigrated abroad.
Medical and dental council.
Taking care of the NHS, for example,
Absolutely.
in the UK.
I'm trained in the UK as a brain surgeon, okay? At least about 6,000 Nigerian doctors who probably trained in Nigeria are there. About 6,000 of them. In America, up to about
Prime Minister Theresa May, eulogized the Nigerian health.
And I am telling you, Christian, that out of these 40,000 doctors who are in Nigeria, you still see young doctors coming out of medical school looking for jobs. You see doctors who are post NYC looking for jobs to train as postgraduate doctors, and there are no spaces. And you see UK with 300,000 doctors.
Why are there no spaces?
There are no spaces because healthcare is not a mainstream socio-political issue in Nigeria. It's not a main issue. It's not an issue of major frontline concern for the Nigerian government.
So take care of the well-being of the people.
Take care of the well-being of the people. Take care of the well-being of the take care of yourself, you the political elite as well. Because if you have an emergency, you are going nowhere. Look at the issue now. Everybody's scared now. In local parlance, how do they say? They say, going down blow found yash don't open. You understand? The inadequacies within our healthcare system is staring everybody in the face now. It is time, Christian, that we now critically look at these issues and not play politics with them like you said. You find maybe an institution, right? And then this thing of playing politics, and then the chief executive of the healthcare institution says, we have 4 ventilators, for example. Meanwhile, in reality, if you go back and speak to the staff on ground, they tell you that yes, we have 4 machines there, but none of them are working. What is this thing of being so economical with the truth when you have a dire situation like this? What is it with continue to play politics? Of course, the 15 billion this is naira that we're talking about from this private group. That's like
over 25 billion.
Okay, now we're talking about over 25 billion. Thank you for.
I think it should be hitting about 30 billion by the weekend or so.
What do you think the average Nigerian thinks of that? Do you think the average Nigerian trusts that this money is going to be used effectively and efficiently to actually do things for now?
Well, I think with private involvement, it's different from public service and the rest, because they want to see their money well spent. I'll give you an example. The GMD of NNPC who just left here now, along with some other international oil companies from that sector, what they've put together is over 11 billion naira. Yes. But some are donated in kinds, ambulances and the rest. Yes. Like 5 ambulances to this day do. That's one of the isolation centers by federal government.
Yeah. So basically, like I said, you know, sir, while it looked like I was trying to take a swipe on them initially, I'm saying we have to move forward as well, isn't it? So fantastic job that all these guys are doing, putting all the resources together and stuff like that. But the question is, in terms of the strategic leadership and management, to actually use these resources appropriately and stuff like that, you will agree with me that the average Nigerian has a big question mark on his head and is wondering.
Okay, Dr. Okor, let me put you on pause there because we want to take some messages. When we return, we'll continue to interrogate the matter. It's time for a short break. When we come back, we'll still be in the future of Nigeria's healthcare after COVID-19 with Dr. Douglas Emeka, Okor, a UK-trained neurosurgeon and health sector reform advocate. Still. Back to the morning show here on Arise News. I am Christian, although it's a special edition that is coming to you from Abuja. And I still have Dr. Emeka Okor, who is a neurosurgeon. Dr. Emeka, I want us to look at the psychological effect of this lockdown. As a neurosurgeon, I mean, you have done a couple of clinical psychology and the rest. What kind of effect will it be having on the people generally now?
Well, Christian, I'm a neurosurgeon. I'm not a clinical psychologist.
I know.
But basically, yeah. See, so there's the issue. I'd like to actually, before I talk about it, I'd like to talk about the issue of the amount of information that's going out there and the kind of information that is going out there. I think I want to warn people, please be very circumspect. You know, I'm very critical about the kind of information you get, especially on social media.
That is digested on this
absolutely,
COVID-19.
because it can actually, in terms of the psychological effect, in terms of the fear, you understand, it can actually worsen. It can even be worse than the COVID itself. Okay, so definitely there's significant psychological effects. Okay, from the point of view of the fear of a disease that is in European countries is wiping out this 900 people a day.
That has even put the British Prime Minister into intensive care.
Absolutely. So the fear, the psychology, the fear linked to the psychology will be there. Of course, there are the issues of the economic situation from the lockdown itself.
It's capable of causing some kind of dementia.
Absolutely. Well, not dementia, but definitely fear. Okay, people who maybe had.
Well, by the time they start having such fears, then a situation of agoraphobia develops.
Yeah, absolutely. Yes, sir. Absolutely. And that is why the key thing of this issue of strategic communication is very, very important. I give kudos to the NCDC and the Lagos State government for this
fantastic
job, coming out, giving information and all that. Really, really great. We need to do that more. Like I said, Christian, we are in a difficult situation. Lockdown, is that what we need to do? Probably yet. How do we actually do it? Very, very difficult. That's why pulling experts and pulling heads together is what I would seriously advise the NCDC and the Federal Ministry of Health. In terms of moving forward and how we actually do things. Okay, this is not the time to play politics, especially from the mainstream political elite. Engaging with these experts and people who have very good ideas of how we can actually move forward is the way to go. Please, this issue of playing politics and stuff, this is not the time. We seriously hope, Christian, that we do not get to the point of France, Italy, and Spain, or UK or US.
That would be disastrous.
Terrible.
That would be disastrous because we've got so much on our hands already with the Northeast terrorist program going on there, where even the Sultan of Sokoto had described the entire northern region as a cemetery or a burial ground because of the annihilation there. But let's look at some kind of collaboration between the Nigerian Medical Association, the General Health practitioners, and the National Orientation Agency. There isn't much in terms of fusion, synergy, and exploration.
So true, Christian. When you talk about strategic leadership in health and building health systems, partnerships and collaboration, if I call it the CCP way, okay, collaboration, cooperation, and partnerships, it is the way to go. But for some reason, okay, culture is dynamic. Over the years, last 40, 50 years, that culture of being your brother's keeper, pulling together, we've lost it. All the issues of nepotism, tribe, and stuff like that has destroyed those things. We've played politics too much. All over the world, we all play politics. The US people, they play politics. But the politics is not to the detriment of governance and actually building institutions and developing the society. Okay?
But some people may not readily agree with you that even in the Western Hemisphere with advanced medical facilities and the rest, why then are they dying in droves?
That's a good question, isn't it? The issue of this virus is the novel is new, isn't it? Even though they have very developed healthcare systems.
That's why they call it a pathogen. Right?
Absolutely.
We thought that with the Spanish flus, they would have gotten their hands on this easily.
Well,
because some people still think that, look, it's just like the common cold. It's only when you have complications from other ailments and the rest that it really knocks down your immune system.
Well, the truth is that at least with the information we have now, in a way, you're actually right. It is like the common cold, but remember, like an exaggerated form of the common cold, okay, with more significant impact down the line. But the key thing is this, okay? Even though you have developed healthcare systems in there and they are struggling like that, when you try and marry that or try and compare that with what we have in Nigeria, you almost like want to say, man, everybody go on your knees and put your hands together. Like I said before, if that happens in Nigeria here, wow, okay. Now, presently,
you think we don't have the capacity to arrest it, even with the measures that the federal government and the private sector is putting together?
Christian, I know you are actually interviewing me, but I wouldn't mind asking you to actually give an answer to that question. No, the answer is clear, Christian. We don't have capacity. Okay, leadership and management at the Federal Ministry of Health, at the Federal Ministry of Health.
Let
me try and go through it.
handled the pandemic before.
Oh yeah, we did handle
And we
it.
handled it perfectly well.
We did.
And that was kudos to the Nigerian medical workers.
Within the limits that we could, fantastic. You know, it's just like when we go to play, you know, international football and stuff like that, and everybody's praying, oh, I hope that the Super Eagles do very well. Whether they trained or not, whether they prepared or not, we just hope that they win and stuff like that. We should change that sort of behavior.
You think it's attitudinal problem?
Absolutely.
Not the manpower. The manpower is
absolutely, because of course the attitudinal problem, the culture that we run with now and stuff like that, often dovetails into everything that we do. So when you talk about strategic leadership from the Federal Ministry of Health level, the NCDC level, other ministries, departments that should be supporting healthcare as well, when you talk about the issues of human resource for health and training, we are struggling. When you have less than 40,000 doctors or 200 or 200,000 people, you should be the most innovative people. You must think outside the box. There are issues of what we call the task shifting and task sharing, where you actually look at advanced practice for other healthcare professionals. We should now start having nurses, physiotherapists, pharmacists, that even start taking some of the roles of doctors, especially in our rural areas. Back to the basics again. Primary healthcare is the fundamentals of healthcare in any place at all. This issue of, governor, I built a hospital, I'm building a teaching hospital. Please, NMA, can you not tell them the truth? That is not healthcare. That is not providing healthcare for the people. That is plain politics. That is doing, we're going to build one building.
What would it be, Emeka?
What it should be is, let us truly focus our resources on primary healthcare. Let that man, that old man in your village be able to get to a place where that place, in terms of the leadership, management, funding, human resource for health, okay, technology. Oh my God, we're in 2020. Technology, you understand, is an innovative tool that you can use, especially when you have limited resources, especially for human resource for health. Let that old woman in that village go into a place, okay, and those primary health centers are a platform to actually empower people with respect to preventive health.
We had that, in the 80s, during the time of late Professor Lukoye Ransom Kuti. He felt that
He put some skeleton down.
Yeah, because of his own experience with WHO, UNICEF, and the rest, and as health minister, that was the focus in developing Nigeria's health system.
Professor Ransom Kuti, for understanding the importance of that and actually putting a skeleton down. But in terms of scaling up, it takes leadership, isn't it, that understands. Okay, so since that time till now, what kind of leadership at all levels have we had in Nigeria? Have we had leadership that understands the fundamentals and realities of what a people need, to live fruitful lives? That's where we have struggled. And I'm saying once again, Christian, that at this particular point in time, the pandemic, opening up to everybody that may hear how weak our systems are. Which system are we talking about? Regulatory? Our regulatory systems, especially within the healthcare systems, extremely weak. Extremely weak. You understand? We have to take steps. And what steps do we take, Christian? Number one, strategic leadership. Let us communicate more. And what does communication means? You understand? The issue of looking at data. Okay? All this issue of identity management and stuff like that. We can use platforms like the BVN and stuff like that. Let's start knowing how many we are, where we are and stuff like that. Let's start looking at our healthcare facilities. How many cardiologists, neurosurgeons, cardiothoracic surgeons, infectious disease consultants do we have in National Hospital, for example? How many do we have in the teaching hospital in Ilori or in Lagos and stuff like that? Okay? We do not have capacity. And at the same time, you have doctors looking for work in the same place. And then you see the National Assembly saying they want to vote 37 billion to refurbish their place. Oh my God. That is so saddening. Extremely saddening. And so again, I hope that we use it as a silver lining and move forward from here.
I can see your passion and your pains, the permeates your entirety. Is this particularly for the rural people if this COVID-19 extends beyond what we have on ground now?
Is that what you... Christian, God save us if that happens. God save us. I'm sure we know the conditions that people live, in places like Ajegunle and stuff like that in Lagos, or in the suburbs.
Those are urban slums.
Absolutely. I'm sure you know that. Imagine coronavirus getting into those places and moving around. Just picture it in your head.
But with the lockdown, some people have even been saying that how do you lock down the people in areas like Makoko, Nyanya, Maraba, Sabon Lugbe? These are
Real
slums,
questions and very genuine questions, especially with the issues of, oh, these people live from hand to mouth, do you understand, stuff like that. So in reality, we can only do what we can do, but not doing anything is not an option. Okay, we can only do what we do. What we should do is that we should work like we're not praying and pray like we're not working. That's what we should do. Okay, but there will be life after COVID-19. What are we going to do after that? Hopefully, this usually epidemics and pandemics like this span usually months to maybe like a year, maybe like 18 months and stuff like that. This will go away. We pray that in terms of the fatalities and stuff like that, you understand, that whatever seems to be protecting us, you understand, there are lots of research going on. Oh, how come? You understand? I gather that even the people in the West, are looking at us and saying, oh, how come they're not dying like us?
And chloroquine seems to be working magic.
Well, there are lots of studies. The guys in France and some other people seem to feel that it helps. So
I'm sure a lot of Nigerians who want to hear that French connection to it,
well,
come and test that.
and the Chinese one as well.
Yeah. So what a way to drop the curtain, on this segment, which is Dr. Emeka Okor. He's a neurosurgeon specialist, trained in the United Kingdom, and he's a visiting neurosurgeon to one of Nigeria's hospitals here in Abuja. Thanks very much for being part of it.
Thanks, Christian. Thanks, Arise TV.
Cheers. It's time now for a short break. Many more still ahead, including after the break.